A nurse-patient ratio is the number of patients assigned to a single nurse to care for during that nurse's shift. These ratios vary throughout inpatient settings due to patient volume and acuity. No matter where we are in the healthcare setting, one fact remains. At some point, assigning more patients to a nurse becomes unsafe and begins negatively affecting both the patient and the nurse. Nurses play a significant role in care as they are present throughout the patient's encounter, having a direct impact on their health outcomes. All these tasks they perform are essential in providing quality care and patient safety. It is then imperative to point out that the ratio of assigned patients to a nurse is directly related to the nurse's ability to provide effective and safe care. About 193,000 openings for registered nurses are projected on average each year over the next decade, and employment for registered nurses is expected to grow faster than the average of all occupations. In addition to the increase in demand, there is also an increase in staff shortage, which is primarily due to elevated stress levels and burnouts, low job satisfaction, and high staff turnover. This has resulted in rationing of nursing care becoming a common problem in healthcare institutions. As the number of patients per nurse is increased, patient safety is impacted, resulting in undesired clinical outcomes. This issue has a heavy impact on nurses, patients, and the hospital. For nurses, having too many patients can lead to elevated stress, missed care, medication errors, unintentional spread of disease throughout the facility, and a heavy workload that would surely lead to burnout over time. For patients, having a nurse who has too many other patients may leave the patient feeling neglected or cause more severe impacts such as infections, falls, readmission, extended length of stay, and even mortality. Poor patient outcomes and decreased patient satisfaction results and translates to higher costs and lower reimbursement rates, making this an issue all administrators must prioritize. There are as many opinions on how to fix unsafe nurse-patient ratios. Lobbying for federal regulation of maximum nurse-patient ratios based on acuity. We could also adjust staffing on a workload intensity base. That is, how many patients a nurse is given is based on the amount of care required by the patient. Whatever the methodology used, unsafe nurse-patient ratio are a problem that must be addressed.